Thank you so much, Dennis, and thank you so much for inviting me to this workshop. I've learned a lot already, and I really appreciate to learn from all of you what you're doing. So what I'm going to talk about is, I extended the topic a little bit because I extended it to my German community as well, which explains how I got into social media, which was completely unplanned, probably like with most of us. I'm actually, like Dennis said, a patient with chronic myeloid leukemia, and when I was diagnosed about 10 years ago, the survival, that's years, was probably somewhere here. So the standard treatment would have been a bone marrow transplant, but I had the, let's say, privilege to speak English quite well. So I went on the internet, and there was a lady in Singapore who was reviewing everything that was published in English because her husband had CML. And she was actually summarizing everything for patients on a Yahoo group. We heard that before. And I joined that group, and I thought, okay, when I digest that for myself, why don't I translate that in German for patients in Germany that have the same problem? So I joined a phase 2 clinical trial at that time and had the luck to access a new drug that was coming up in the early 2000s. And at that time, there was a big lack of information. In almost every country, we were curious what was happening with these kind of new treatments, but nobody really knew it. And the turnaround time of paper-based information was so long that none of the patient information that was distributed in the early 2000s covered anything of these new treatments. So that was the time when many of these grassroots initiatives emerged, when somebody set up a website or a Google group, or Yahoo group. No, Google was not present at that time. Unbelievable. And so there were a couple of Asian and US-based groups and so on. And when I was actually home just for a weekend because I had a flu, I thought, okay, why not test it myself? And at that time, open source was coming up, and there were new community systems. And over the weekend, I was a technology geek. I thought, let's just install it. I'll try it. And then I discovered, oops, that works in 3 hours. And so I had a website up and running basically in 3 hours. And at that time, nobody was talking about social media. It was just, let's say, a platform to share information on the web. And that was in 2002. You can see that's a screenshot from 2002, about 1 month after I launched it. And open source was actually the main facilitator. Like you were saying, it was a free platform. I downloaded it, installed it. It worked immediately and was fabulous. And at that time, already a lot of things we're talking about today in user-generated content were already part of these platforms. So people could not only discuss in discussion forums, but they could contribute web links, they could comment on articles like in blogs, but nobody knew what a blog was at that time. They could contribute book reviews, they could contribute words in a glossary. And so all that was already in that platform. I just had to turn it on and put some content in the beginning. And what I was doing in the beginning is just translating information into German language from trials. And I was actually moderating a discussion forum. And just within weeks, it was just populated and worked and so on. And it was just fabulous. And so in that sense, it was really a revolution because it gave tools into our patients' hands where we could just, without money, I paid for it 4 years out of my own pocket. We could just, without any money and funding, we could just get it started on the web. So in 2011, so the platform basically survived for 8 years. That's quite remarkable. But of course, there were a lot of security issues and so on. And that's why we built a second new platform, which was really integrating a lot. But what we from social media, but what we really focused on is we wanted to preserve what people had done in the forum. So we have about 16,000 forum posts where people were discussing, young patients were discussing about pregnancies, about side effects, about coping with the disease. Such a wealth of information we didn't want to lose. And that's why we migrated the old style forum and we complemented the whole platform with blog-like comments, with Facebook-like area and so on. We integrated Twitter so people could see the Twitter feed on the page. For those that don't know how to use Twitter, they just need to go to the website and so on. So we tried to integrate it smartly. But what was very important, the average incidence for my disease is 65. So most patients are on average 65. I'm an exception. So most people are not so familiar with technology, with internet and so on. They might have seen forums for a couple of years, so they might use it. But when they see Facebook, that's something for my daughters, but not for me. And that's why we try to adapt, let's say, the old style web and extend it by social media. And that's so much about my German community. And later on, if you have questions, we can go into live demos of any kind of functionality on the computer. But I just thought I put it on slides. But what we've seen over the years, that we need to grow networks because CML is a rare disease. It's a rare cancer. And we needed to join forces across country borders. And that's where 4 groups actually started the CML Advocates Network in 2007. Because we said we need to have a virtual internet platform where we can join campaigns. And so today it's a global network of 57 groups in 47 countries. We're going to have our annual meeting tomorrow here in Amsterdam. That's why I was so glad when I heard that eurordis is going to hold this meeting here in Amsterdam as well at the same time, because that gave me the opportunity to be here as well. But that platform actually is also, let's say, it never had any budget before, and that's why we built it just on open source and on social media to connect all the different groups. And what we've actually done on that platform, we integrated old-style discussion forums. We have most of the page is hidden behind passwords, so only patient representatives can access it. It's not for the patient, it's for those that run groups. And so we've also included Twitter. We've included a wiki, which is only available to members. We have a photo gallery because people were meeting maybe once in a year when they came to our annual conference. And then they wondered, what was the name of this guy from Mexico, just as an example. And then they can just go to the gallery and say, this is the guy. And another one has probably put the name to it because they could contribute with comments and things like that. But we didn't want to use Flickr because most advocates didn't want their photo on the public web. And that's why we had it all in a closed area of the website. We didn't want them to register for Google, register for Yahoo, register for our website, and so on. And that's why we had a central platform. And probably we can go into any kind of demos. What are the key learnings from building these platforms? I've built a couple of other social networks, but those are probably the most important ones for CML. Some critical words about Facebook. I don't know who said it before, but I also have some reservations about Facebook because our impression in cancer is cancer has a lot of stigma. People, when employers hear about cancer, people no longer get promoted. If they hear about cancer, they're probably not allowed to have any more insurance or whatever. And that's why our impression is that no patient really wants to use Facebook and connect their private identity with their cancer identity. And that's why we've built a couple of Facebook pages, but I would say popularity is very low. While if you want to do campaigns for the public, make people aware about the disease, like Rare Disease Day, where you're fabulously making the whole world aware about rare diseases, that's excellent because you're addressing the general public. And maybe those groups where you don't care, you're just keen on learning about the disease, no matter whether you're connected personally with it. But in cancer, it's a different, difficult thing. The second thing is that Web 2.0 or social media needs to be an evolution of the standard web. It's not a mean by itself. People are not interested in technology. So they want to use things like they are used to use things and then experience that things might be even more sophisticated, but not the other way around. You don't need to require them to do all this registration, two or three pages of registration to provide all their data until they get there. And that's why I was also stressing don't overestimate technology affinity. I mean, the problem is I've been implementing all different kinds of social media technology, but I would say its usage, even for blogs, for comments in blogs, is relatively low. Most people, like when Jan Geisler goes to medical conferences, he writes an article about the conference and they translate it into Malaysian, into Hebrew, into Russian, and so on. But they don't want to interfere with the content. They don't want to comment on it. They don't want to say that they don't understand. And that's why probably we need to be careful in overestimating social media in the sense of it's a good tool for us, but it might not reach the average patient. Twitter, I mean, I'm very active on Twitter, and I only use it on the mobile phone, actually. But only a very small minority of those people I know use Twitter. And that's why we've integrated into the website that people can see the Twitter feed without being registered and knowing Twitter. And old-style forums and mailing lists are quite heavily used. So probably you need to connect the old world and the new world here. And one thing we learned from Leukemia Online, which is a website for patients, and CML Advocates, which is a website for advocates, is that the tools are different, the needs are different. Sometimes the sophistication for advocates is quite high, so use of wiki or use of, let's say, file sharing and so on is quite important for those that run groups, but the general public might not be interested in that. They might not want to dig so deep into technology. And that's basically already the end. I wanted not to talk too much because I wanted to discuss. And so that's actually my email address and my Twitter account if you want to get in touch with me. And I'm open for any questions you might have.